Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great start to your day. We appreciate you guys coming on. Always fun. Let me see if I can say hello to a few friends as you get your notifications. How about that? I think I can. Okay, let me just see. Who's up? Numero uno. Rosalinda. Niagara Falls, Sandy from Fergus Falls, Minnesota. Jocelyn, Sturgeon Falls, how are you? Lynn from Aurora. And Andrea from Niagara Falls. And Sandy from Chilliwack, British Columbia. Bright and early. You know what, Sandy? I appreciate you getting up early in the morning and joining us live. And Janice from Brampton, Elaine, Carol from West Virginia, Danny Lay from Iron Bridge, Ontario, Bonnie, Little Britain, Fran, there you are, Fran. I usually miss you. I don't know why, but hey, I saw your name this morning. From Orangeville, Caroline, sweet Caroline, how are you? Judy, New Brunswick, Lorraine, Frida, Georgie, Halifax, Nova Scotia. Dave from Muskoka. Mary, how are you? From Anaheim, California. Babita, how's my friend from Brampton? Yolande, bonjour. Nice to have you on. Nativity, how are you, Nativity? We love you dearly. Merrily. How about Mary? From Gander, Newfoundland. Sharon, Kansas. Sue from Bolton. Patricia, Pulaski, Tennessee. Love it. Dave from Cardiff. Wendy, how are you? From Markham. Francis, Dorothy, Edmonton, Alberta. Rose, how are you? Cheryl, John, Elgin, Illinois. Denise, Karen, Peterborough. Bruno, bonjour. Bon matin. Annette, how are you, my dear Annette? Diane from Peterborough. And Fran, another Fran. No, Fran, you're out of the clouds. That's what you wanted to say. Cheryl, West Virginia. We love you dearly. Bonda, PEI, Cecilia. Herma. Herma, is this the first time I've seen your name? Anyways, if it is, thanks for coming on. Guess who just came on? Brahim. How are you, my friend Brahim from Portland, Oregon? Rita, Kevin, here comes the mayor of our private Facebook group. We call him the mayor because he's been elected. I don't know if he's elected, but I elected him. Kevin, how are you, my friend from Oshawa? Marianne. Abdo. How are you, Abdo? Chantal. How are you? Long time no see that name, Chantal, from Ottawa. Sylvia, Cindy, Rough Rider Nation, Saskatchewan. Yeah, they won the Grey Cup. And Brahim says it's Facebook notifications why he's late. Andrea is saying, Brahim, you're late to the party. Sandy, Gary, Madeleine, Kippawa, Quebec. We love you dearly. Okay, here we go. Love you, guys. Thanks for coming on. I know I missed some of you. For example, I think I missed Dr. McEwen this morning, but I love her. She knows that. Okay, we love you. Thanks for coming on. Thanks for saying hello. Thanks for getting up early. We appreciate it. You have no idea. What would I do without this audience? What would I do? I'd be talking to myself, which isn't unusual. Okay, guys. So let's continue with Q&A. Okay, so these are questions that I didn't get to the other day. So let's talk. Judy, can you let me know what a good product is for heavy period? Yep. Listen, I'm a big guy on DIM, D-I-M. Okay, it's an extract. It really works. I've proven it over the years. Fantastic. We have it in our menopausal formula, okay? Our menopausal formula. Get on that, even if you're not in menopause, obviously, okay? But the DIM in there is so good. I even got men on that DIM in the menopausal formula, just to shrink the prostate, because estrogen is a growth hormone. You want to block estrogen, the extra estrogen, okay? So that's very important to do that. And DIM is great. And here's another thing, flax seeds. Now, flax seeds don't have DIM, but they have lignans. And lignans, Lignans, lignans are tremendous to block extra estrogen. This is why I like flax seeds. I've always been big on them. I've been preaching this for 50 years, guys. Okay? Like, of all the seeds that I want you to eat are flax seeds. Okay? Now, if you have trouble with diverticulosis or diverticulitis, for example, then you need to munch up those seeds. Okay? You don't need to do it, but if you have trouble with any kind of diverticulosis, I always recommend grounding the flaxseed. You don't have to ground them, by the way. You get the lignans without grounding, but if you ground them, that's all right too. I got no problem with it. So DIM and lignans, okay? Got the memo? Really helps with heavy period. Really helps, because it's an estrogen dominant thing. Too much estrogen compared to progesterone. And that can start in a young lady who just starts menstruating. I've seen it 1,000 times, more than that. And we could really help them in our clinic with heavy menstruation, okay? So thanks, Judy, for the question. Faith, what does Dr. Martin recommend for a drink to open up the detox pathways when doing a parasite or heavy metal cleanse? I'm glad you asked, Faith. I really am. There's two things I recommend. One, water. Yeah, water. Water is a natural, nothing better, detox. Cleans, cleans, cleans. Why? Because your pathways to detox go through your liver and your kidneys. Okay, lungs to some extent, but not the same. Kidneys and liver. Always think of those two as your detox pathway. Yeah, your bowel to some extent, of course. But your biggest organs to detox are your liver and kidneys. And if you're doing a parasite cleanse, our probiotics are a tremendous parasite cleanse, and I recommend it with oil of oregano. Do the two. Not going to get better in terms of parasite cleanse. Oil of oregano, 3 or 4 drops a day, okay? Take them any way you want. And broad spectrum probiotics, especially with the L. rhamnosus and the L. reuteri, which is part of our immune boosting formula. It really helps detox, okay? And then water. Water flushes Niagara Falls. It flushes the kidneys, okay? Plus, okay, let me give you another one. Coffee. Coffee is a great detoxer. You know why? Because coffee because of its proanthocyanidin and all of the flavonoids that it has, it is such a good liver detox. Water, coffee, okay? And don't gum up your coffee with sugar, okay? Because now you're defeating the purpose. But coffee also is coffee and water are the best for your bowel to clean out. Coffee, the best fiber in the world is coffee. Guys, I'm not just saying that. I used to say for years, I got 150 studies on coffee. Now I got more than that now, 200. Every time they look at coffee, they can't believe it, how good it is for everything. Yeah, you got it. And I've been saying it consistently. When everybody else, and I mean it, even guru, well, coffee's acidic, and it'll dehydrate you, it'll take away all your minerals. No, it don't. It don't. Okay. Anyway, don't get me going on coffee because you know what I think about it. And you're not changing my mind. I've got too much research to prove it, including clinical research. Okay, and Faith, what information can I find helpful after doing a Dutch complete test? Okay, well, that's one of the tools in the toolbox to look at hormones and things like that, the Dutch complete testing. I got no problem with that. I had a version of mine in my clinic. But I always say this, Faith, okay? Always say this. Remember, when it comes to hormones, symptoms trump blood work, including the Dutch testing. I'm not against it. I like it. I did, in the years past, I did hair analysis. I did urinalysis. I tested, I did skin testing for thyroid. You name the testing. I love testing. I didn't guess, I test. But I never would see a patient without a questionnaire. Why? Because a lot of times, in spite of all the testing I did, a lot of times, symptoms, especially thyroid symptoms, trump the blood work or the urine work or the saliva work. I like the whole package. Okay? Thanks for the question, Faith. We much appreciate it. Okay, Cindy, I'm doing EMC for 4 years now. You're a smart girl. Okay? You're a smart girl. Eggs, meat, and cheese. And continue to do it. Now she says, I have gallstones. Well, I can guarantee you, Cindy, you had gallstones way before your EMC. Okay? Women get gallstones. A lot of women get it. Okay? A lot of women, I know I'm speaking to my audience out here, even live, would put their hand up and say, I don't even have a gallbladder. Why would women lose the gallbladder? Well, the primary reason is they didn't use it. When you're fat-free, your gallbladder, it's not doing anything. It's just storing bile. And bile is needed to emulsify fat. Break it down. Absorb the nutrient. Like your gallbladder is really important. Now listen, if you don't have a gallbladder, remember your body has plan B, your liver. Because that's where bile comes from anyways. Okay, and sometimes when you don't have a gallbladder, you have to watch your fat content. Why? Because you don't have a gallbladder. It doesn't mean you're not producing bile. It's just that you're not producing enough of it. Now, and I say this to you, Cindy, in all due respect to you, okay? Because I can tell you 100% for sure, eating eggs, meat, and cheese never causes gallbladder problems. It doesn't. And if you're an exception to that, well, there's always exceptions. But I just tell you, those stones were forming before that. And the other reason, okay, use it or lose it, the other reason is hormones. When you don't have enough progesterone, pro-baby, okay, when you don't have enough of that, and that often happens in women after a baby, because all of their progesterone was left in the placenta. And then, your body didn't keep up with progesterone. And progesterone is very important for smooth muscle. Now, what is smooth muscle? Well, it's muscle. Like, you can't just go like this and contract it. It'll contract. But you don't rule over that. So smooth muscle, think of your bladder, ladies. Okay, men do, but especially women. Think of your gallbladder, ladies. It relies on progesterone. Well, what if you don't have enough? Yeah. It can start giving you trouble. Gallstones. The smooth muscle is affected by progesterone. So you have those big factors. Okay? And, then you would have estrogen dominance and not enough progesterone being produced. A lot of times, postpartum, that's what happened. And women, I lost my gallbladder after having a baby. It happens. It happens. Okay? And, but gallstones has been proven 100%. It's when you don't use it, you lose it. And when the world went stupid in the 70s, in the 80s, and we're still stupid. When it comes to nutrition, we're still stupid. Fat makes me fat. Fat gives me cholesterol. I'd rather have a salad than a steak. I heard that a million times. It's so silly, and it is not based on any science of nutrition. But the world went stupid. It went fat-free. Like you still see it in the grocery store, fat-free. Okay? Because to the world, the stupidity, it's all about calories. It's all about eliminating fat because that'll give you cholesterol. Were they right? No, they were 100% wrong. And I screamed like John the Baptist for years. You're wrong. Ladies, don't listen to the fat-free. It ain't calories. That was me screaming. Okay, let's get back to these questions here. That was Cindy. And Cindy, we appreciate you. Okay? And what to do now? Well, you're going to have to be careful. I don't know if they're talking about taking that gallbladder out. Sometimes you got no choice. Sometimes you have no choice. If you don't want a stone getting caught up in one of your ducts. And I don't mean ducks like ducks on a pond. I mean little ducts between your gallbladder and your pancreas. Like you don't want that duck. Okay? Suzanne, how are you? Her sister was put on a cholesterol-lowering medication because she had narrowing of the arteries, her carotid arteries in her neck, okay? And she tried to get off the cholesterol medication, but it didn't lower it enough, so they decided to put her back on the cholesterol drug again. What's Dr. Martin's suggestion? Well, look, okay? You have to... And anyway, Susan, hold on a minute. Yeah, that was Suzanne. Suzanne, look, in my opinion, because your sister's not my patient, so you have to understand I'm just giving generalized information. Do you know that statin drugs, they don't remove plaque from the arteries? They don't. They lower your LDL cholesterol, but I haven't found them to be effective at all at taking plaque, because that's, if you're narrowing in your carotid arteries, you got plaque in those arteries. I've never seen that happen. Like when I had patients in the office, I never told them to get off meds. I didn't do that. I said, well, here's the side effects. Here's the benefits. And I often gave them alternatives, and here is an alternative. But you got to decide that. I can't decide that for you. I'm not doing that. I'm not doing it. I just found over the years, and you guys know this because I've been consistent. For anybody listening to me today for the first time, I've been so consistent about this. I'm not a big believer in statin drugs. They should have got fired a long time ago. Fired. Why? Well, what kind of results have we been getting? Heart disease is worse than ever. Carotid artery calcific plaque is worse than ever. Because it ain't cholesterol. It's sugar, my friend. Sugar destroys blood vessels like nobody's business. Plaque. Calcium in the wrong places. Calcium's good for you in your bones and in your teeth, but not in your blood vessels. Sugar isn't good for you at all, and it certainly doesn't belong in a no parking zone like your blood vessels. Okay? Anyway. And I listen, I would elevate her nitric oxide, which is why I love Navitol. There's nothing better to elevate nitric oxide, okay, opening of the blood vessels, like pine bark extract. There's nothing more powerful. In all the years I've studied it all. Coffee's good though too, because it elevates your nitric oxide too. Is there anything coffee doesn't do? Ooh, I love it. Okay. And high DHA. That combination I would recommend to your sister, whether she takes her statin drugs or not. Okay? Thank you for the question. And that was Suzanne. Tamanetla. Andrea. How are you? Andrea. Asking a good question. Okay? Very good question. I'm glad you asked it, Andrea, because it gets people thinking. And I love getting to people to think. Okay, here's her question. Okay, this is Andrea. Dr. Martin talks about thermography versus mammograms. Yeah, I do and I don't. Okay, I'll get into it in a second. Let me finish your question. If it takes 5 years for cancer to grow to the size of a tip of a ballpoint pen, okay, how would thermography detect any abnormalities? Well, that's a stinking good question, Andrea. Now remember, a thermography isn't meant to detect cancer at all. It's not. Okay? Thermography, thermography is a heat detector. And I like it. It's a tool in the toolbox, okay? And one of the first things that happen, if the body starts growing a tumor, even if it's small, like eensy-weensy, teeny-weeny, yellow polka dot bikini, small, okay? Well, thermography shows you heat. Thermography, okay? And a lot of times, and I saw this in my own practice, I used it as a tool, and I liked it. It wasn't everything. It's really important. I used to tell my patients that. It's not everything, but it's something. And if you have inflammation, if you have heat coming off breast tissue, you better be careful. And the problem with a mammogram, and guys, you know this because I've been talking about this for a long time. Do I tell women not to get a mammogram? Nope. I don't do that. But I give them info. Mammograms, okay, the amount of radiation, they don't tell you that, but the amount of radiation is incredible. And what I found, and this is, by the way, in the Netherlands right now, you couldn't even get a mammogram if you tried, because they said, no, the benefits of it are outweighed by the risks of all that radiation. Plus, they squish your boobies. You got a tumor there. I don't recommend squishing them. And they give you so much false positives. So many women have gone through biopsies. I don't like that. They get so aggressive. And they, oh, well, we're not sure. We might have saw something. You got dense breast tissue, for example, and they send you back. Oh, we need another mammogram. Look, I just think there's better things, okay? And one of the tools in the toolbox, and medicine has never recognized it, not yet, is thermography. I'm not saying it's everything. I'm not. Okay? I'm much bigger on ultrasound of the breast because there's very little radiation. But, you know, you got a big industry, and one big industry, once they get their nose into medicine, big industry, like statin drugs. It's huge. It's the #1 seller of all time. Do you think they want to give that up? And they, you know, ask your doctor if they're not after the doctor. They're not after you. They're after the media. Because they say, remember, we're sponsoring you. That's all that's for. It's not, you know, when they say, ask your doctor if this medication is good for you. How silly is that? As if your doctor doesn't know what medication. You got to go tell your doctor, I want to be on. They're not doing it for you, and they're not doing that advertising even for your doctor. You know who they're aiming at? CBS and NBC and whoever else got, okay? That's what they're aiming at because they want to remind them they're bought and paid for. Because if we take away all of our money for advertising, you guys are in deep doo-doo. And guess what? When you hear about alternative, the mainstream media, oh, that Dr. Martin, he's a quack. They don't like alternative because they're reminded by the pharmaceuticals. Okay. And we see this in Canada big time right now. Okay. The FDA to some extent, but nothing like Canada. They're on steroids to get rid of natural products. And why? Why would they be on steroids when I brought to you a study last week that just taking supplements, or did I even do it? I was going to do it if I didn't. Just taking supplements keeps people out of the hospital. No, I don't think I got to it. You should see the new study on readmissions to the hospital. It saves taxpayers money. But you know what? There's a war. There's a war on vitamin D. There's a war on your supplements, my friend. And we have got to speak up. We have to scream and say, don't you take away our supplements. Because they want doctors to be able to prescribe it. Well, good luck with that. Good luck with that. And by the way, nobody died from taking a supplement in the United States. All of last year and the year before and the year before and the year before. Not one person. But, oh, you're taking vitamin D. Oh. It'll kill you. You could get toxic. You could die. They've never seen a case. Never seen a case. But that's all right. Anyway, don't get me going, guys, because I get pretty excited. You guys know that. Okay. That was Andrea. Thanks for the question, Andrea. We love you dearly, and you're a smart girl. Because you got me going this morning. Regina. Regina. We love you. Regina got woken up suddenly and was dizzy, big time. You got vertigo, my friend. That's in the middle ear. Okay? Now, what do? Yeah, your head spinning like that comes on suddenly, usually viral, or just a displacement of the crystals in the middle ear. A maneuver sometimes can do it and get it back in place, but that's what happened, Regina, for sure. And it comes on suddenly. I've seen it. Like people wake up in the morning and they thought the world's spinning. Like it's scary, or in the middle of the night. Like it's unreal. That's vertigo. Okay? Could lead to Meniere's syndrome. Okay. Merci beaucoup. And that was Regina. Cheryl, why does Dr. Martin's enzymes don't include HCl? Well, there's a good reason for not including HCl. Okay? Cheryl, I'll tell you why. Because a lot of people, you got to be careful when you're trying to put acid back in the stomach. Okay? Hydrochloric acid. Okay? Because in a supplement, you got to be very careful. A lot of people just don't tolerate that very well. I like the other way. I like our digestive enzymes because they support the pancreas. They support the stomach. They break down all of the broad spectrum enzymes that we put in there. The amylase, the protease, all different types of protease, different types of amylase, different types of lipase, because they're broad spectrum. And that really helps. Then I add oil of oregano. Why? SIFO, for small intestine fungal overgrowth, and for H. pylori. Really good for that. So, and HCl, listen, I gave a few patients over the years some HCl, very, very limited, and I found that 90% of those people had a reaction to it. They didn't do well with it. Okay, it sounds good that you're, because you don't have enough acidity in the stomach. Let's add some. You can, but man, a little bit of apple cider vinegar, for example. Some people like that. I got no problem with it. But you'll tolerate that better than putting HCl in a supplement, in my experience and my opinion. Okay? That's why. And that was a good question. And you're a smart girl, Cheryl. Okay? Metallic taste. Dave is asking about that. Medication. Look, I always went the gamut. Okay? They had a metallic taste in their mouth. Okay? Sometimes it was oral. Fungal can do it. Okay? They had a fungal overgrowth in the mouth. Okay, that can be probably the number one thing I found with metallic taste. Medications, high blood pressure, beta blockers, antibiotic, a lot of antibiotics can cause a metal taste in the mouth. B12 deficiency can do it. Okay, B12 deficiency could do it. Go lower, stomach. Acid reflux, silent, or the other one, non-silent. Acid reflux can give you a metallic thing. Not always, of course, but a lot of times it was that. So here's me. I would look, if they were in my office, Dave, I would look at their mouth. I'd tell you got a yeast, you got a fungus. Stick your tongue out. You're fungal. Got to kill that. Oil of oregano. Rinse. Or probiotics internally. Okay? And it really made a difference. So that's a good question. Let me see. I think I'm almost done. Claude. How are you, Claude? How would you recommend storing vitamin D supplement? Well, just don't put it in the sun and let it bake. Even though it's the sunshine vitamin. Okay, vitamin D, we have a darkened bottle, first of all, and shelf life is forever, really. I mean, we got to put an expiry date on it, but I've never seen it really, you want to put it in your cupboard. Perfect place to do it. Drinking, you mentioned drinking, Dr. Martin mentioned drinking pickle juice and beet juice. Well, you never heard me talking about beet juice, okay? Okay, if you want, I guess you could take it. I talk about electrolytes because pickles are, pickle juice, and look for the one with the highest sodium. And just take about a tablespoon of it, maybe twice a day, if you're getting cramping. I found taking an ounce or two of pickle juice before going to bed is an excellent way to avoid leg cramps, because who was asking? Joanne, I've been having some serious leg cramps like Charlie horses, which are very painful at night. You're dehydrated. Okay? And there's no light going off on the top of your head saying you're dehydrated. And dehydration is mostly water, but it's not all water. It's salty water. Okay? And when I say salt, like when you look at your electrolytes, you got potassium, okay? And bananas, forget that, okay? Potassium. I've got a lot of my patients, they actually get electrolytes and they buy them, okay? Just because they find them effective. And if you get a lot of leg cramps, I love pickle juice. They actually, you can go on Amazon, like for a sports drink, and order pickle juice and little things like that. I'm not kidding you. Very, very high in sodium, and I like it. I really do. Now, the beet juice, I can't say I ever talked about that. Like, you see it advertised for nitric oxide beet juice, okay? I don't like beet juice. I'm not big on any juice. But I mean, if you want to take a tablespoon of that, elevate your nitric oxide. I like Navital better than that. But no, beets are good for you. I got no problem with that. Okay? I don't think I've ever mentioned beet juice in the same breath as pickle juice as far as electrolytes. I can't say that I ever have. I don't think so. That was Claude and Joanne. And I think I can close with this. Anna, okay? Anna's asking a good question. Want to talk about RFK Jr.'s changes to HRT warnings, meaning that, okay, a lot of women have missed out on hormone replacement therapy because there was a warning, a black box warning about it because of cancer risk. Heart disease risk was increased with hormone replacement therapy. And Robert F. Kennedy Jr. said it was based on faulty science. I like that. I want to investigate everything. I'm not big on horse's urine. Okay? So the synthetic hormone replacement therapy, I have big question marks and huge caution to the users of it. I think a lot of women now are going to be given estrogen. I don't like it. I don't. I like bioidentical hormones therapy. I was a practitioner of it. Okay? Did I like hormones? Yeah. You got hormones? I was big on bioidentical hormones, but not estrogen. Progesterone. Okay? Progesterone. Natural progesterone. Okay? A bioidentical. The HRT stuff, like, I agree to some extent with Robert F. Kennedy. You know what I like about Kennedy? He's turning the health industry upside down, shaking it up. Vaccines and medications and this and that. Hey, if it's worth it, let it stand on its own. I mean it. Pharmaceutical companies should be questioned. But this one here, and I know he's got a lot of good doctors on his side saying, you know what? Women will benefit from hormone replacement therapy. I have my doubts. Unless it's natural hormone replacement therapy. That's what I did in my office. It was natural. It was bioidentical. Never, 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 never did I use estrogen. I don't like it. You got too much estrogen around you. Ladies, you're full of estrogen. Men, you're full of estrogen. You don't need estrogen, you need progesterone. And I was big on balancing. You guys know that. I taught that for years. Martin University. Okay. I often called my clinic, oh, welcome to Martin University. You're going to learn something today. Okay. I am going to teach you hormones 101. I'm going to teach you nutrition 101 and hormones 101. Okay. At Martin University. How do you like that? Okay. Guys, I think I answered all the questions. Okay. We love you dearly. Thanks for all the questions. We appreciate you more than you know. Okay. Now, housekeeping. You know what's coming to a theater near you? Our new book. Okay. Our new book. Rebuilding Your Temple. Guys, the best. Gifts. You want to think of a Christmas gift? You can't think of a better one. You want to give the gift of health, both spiritually, emotionally, physically? Give them this gift, okay? Rebuilding Your Temple. You're going to love it. Listen, I guarantee it, okay? Easy to read, easy to understand, no deep dives, okay? I'm aiming at the lay person who isn't interested in their health, who isn't interested in their emotional health. Who? What a gift. Give them a gift. You read it and then you give it. Give it out. I'm telling you. What a salesman I am. No, but guys, I mean it. Okay? If you want to sign up, go to martinclinic.com. martinclinic.com. You can sign up. You'll get the first notification that the book's available. Okay? We're really hoping to have it by Black Friday. Okay? So, I mean, that's coming. When's Black Friday? Hold on, I'm looking at my calendar. Is it the 21st or the 28th? I don't know. Where's Thanksgiving? 1, 2, 3. Is it the 3rd or 4th weekend? Okay. I don't remember, guys. Look. Coming. Okay. We love you, love you, love you, love you, love you. Okay? I know I say that, guys, but I mean it. What an audience. Thanks for listening. We'll talk to you soon.